Active aging. The aim of this session is to discuss the physiological and health changes associated with aging and the implications pertaining to physical activity or exercise for people as they age. By the end of this session, you will be able to identify the effects of aging on health, physiology, and adaptation to exercise. You will be able to identify the common medical conditions that are associated with aging and the uncommon medical conditions that are the non-communicable diseases. In general, older people are more interested in their health than in anything else. And the common conditions that we'll be talking about will be, example, coronary heart disease, diabetes, osteoporosis. Uncommon ones, the NCDs, Parkinson's disease, cognitive disorders, dementia, etc. We will return again and again to these conditions throughout the course. By the end of the session, you should also be able to demonstrate an understanding of the common biomechanical and physiological changes that are associated with aging and apply the basic principles of exercise programming. Active aging. The American College of Sports Medicine described aging in these terms, or they defined aging in these terms, that it be the accumulation of biological events occurring over time, the loss of one's ability to adapt to changing events, genetics, and it's inevitable. We will all be getting old from the moment we're born, unfortunately. Our main aim then as we age should be to maintain function for independent living, to maintain a healthy functioning goals, to slow down chronic disease, to increase our well-being, and to increase social interaction. Independence, well, we all want to remain independent to the end of our days. Whether we end up in a care facility or not, we still want to do as much as we can for ourselves, feed, dress, and wash ourselves. This is why keeping physically active throughout our lives is so important. Functional fitness, then, or functional goals, is actually more important to older people than having, we'll say, a nice body, although it's okay. It's more important to be able to bend down and tie our shoelaces, do the activities of daily living, or as the Americans say, the ADLs, run after our grandchildren, and then not become completely fatigued at the end of the day. We want a bit of energy left over. Now, this is the glossary of terms we'll be using throughout this session. Cardiovascular disease, coronary artery disease, and they'll be termed CAD. Hypertension, hypotension, cardiorespiratory disease, musculoskeletal disorders, metabolic disorders, falls, neurological disorders, and muscle energy. We'll be assuming previous knowledge or learning during this complete session, but either way, these conditions will be referred to and discussed throughout this whole course. So our cardiovascular system. Our main changes to the cardiovascular system as we get older are decline in maximal heart rate, decreased cardiac muscle, decreased cardiac output, increase in systolic blood pressure, and a decrease in lung capacity. Also, there is an increase in levels of blood lipids or cholesterol. Doing physical activity has a far greater effect on the heart than aging. Physical activity can reduce the age-related decline in function by 50%. If I could bottle that and sell it, I would be a very rich lady. You can't, you see. Physical activity is free. Coronary artery disease. That is a disease of the arteries caused by ulterior sclerosis, or hardening of the arteries. And then hypertension is chronically elevated blood pressure. I want you to pause now, take out your pens and paper for a little task. The task that I want you to do is, could you write down 5 ways that CAD, coronary artery disease, would impact on an older person's ability to be physically active. Now, see if you've got those, are these. Number 1, restricted blood flow through the arteries creates an extra pressure on heart and raises blood pressure. So high blood pressure. An increase in activity requires an increase in blood supply to the heart and to all other muscles. This reduces the capacity to participate in intense aerobic exercise. So no intense aerobic exercise or activity. Number 3, arteriosclerosis can lead to the formation of plaque, clots, and thrombosis or stroke. Number 4, some medication can slow the heart rate. Example, beta blockers, and they affect the ability to exercise. Number 5 is hypotension. That's low blood pressure, which is a sudden decrease in blood pressure caused by moving from sitting to lying to standing. And number 6 is the daily tasks, the ADLs, such as climbing stairs, walking to the shops, that would require more effort. Let's just look at stroke. Medication, no intense exercise, low blood pressure, and a difficulty with ADLs. They're all the ones that I wanted. Remember, if you can't get out of bed without difficulty, or climb the stairs, or go walking, you won't be able to progress to recreational activities or even the more formal exercise or the gym. So the symptoms of hypertension there are heartbeat sensations, dizziness, fatigue, pain, and headaches. So I'm going to give you a few specific activity guidelines for people who have high blood pressure. Check the hypertension is controlled by medication. Check that the medication is taken. Avoid exercise which involves holding the breath, which could be isometric, and do relaxation exercises. My mantra for dealing with older people and exercise is to think of what you can do rather than what you can't do. Most adults will know their own limitations, but you should know how to adapt the exercise to suit their needs. So, guidelines for coronary artery disease, hypertension are: do aerobic exercise, do low intensity exercise or activities, start gradually and build up the intensity, monitor carefully, and check breathing. You should avoid excessive overhead exercise. You should avoid holding or isometric exercise, holding your breath, and you should avoid compression of the cervical spine, that's the neck. And the key word is excessive. While we all need to put our arms over our head to do things, every day, but if high blood pressure is present, this just exacerbates the problem. Tilting the head back can compress the cervical spine and stop the blood flow or the oxygen to the brain for a split second. That can cause dizziness, possible fall, possible fracture. No need really to tilt your head back when exercising. It doesn't do anything. If you want to do neck exercises, pull your shoulders down, tuck in your chin, elongate your neck. But anyway, we will be returning to this later. Let's look now at cardiorespiratory disease, or chronic obstructive pulmonary disease, COPD. That would be asthma, emphysema, and bronchitis. A number of age-related structural changes are apparent in the respiratory system of an older adult, and these are the things that you'll probably find then. So with COPD, the main changes are stiffening of the chest wall, a decrease in the thoracic cavity, diaphragmatic muscle atrophy, that's your breathing muscles, and increased calcification of pulmonary blood vessels. And the symptoms of these would be coughing, wheezing, shortness of breath, lack of energy. And do ensure that that the medication is available, example, inhalers, and most people know how to deal with that themselves. Now, despite these structural changes, the respiratory system is usually not considered a limiting factor in either young people or older people. Otherwise, if they're healthy. Now have your pens ready again for another task. Respiratory disorders still. Task. Jot down 3 ways COPD would affect a person's ability to carry out everyday chores and do exercise. So how did you do? Let's read out. The implications of somebody that has a respiratory disorder are a decrease in the ability to get oxygen into the lungs. This would mean that you get breathless quicker, you tire sooner, you have less energy, you are less active, and that all leads to being reduced, having reduced mobility. So, did you get any of those? So let's look at what you should do for someone with this disorder like this, who actually could be in your exercise sessions. Do long and gradual warm up and warm down. Give plenty of rest periods. Give activities that improve posture and activities that improve diaphragmatic breathing, and do flexibility, mobility and stretching exercise, and keep a close eye. Observe them closely. Physical activity guidelines for respiratory disorders. Avoid activities that cause straining or breathlessness. Avoid isometric exercise. Avoid fast or sudden movements. Avoid long bouts of activity. NB. Check environment for potential irritants. Moving on to musculoskeletal disorders. Symptoms would be reduced muscle mass will mean less absolute strength. Joint stiffness, reduced flexibility, and slower responses from muscle fibers. So, arthritis is one of these musculoskeletal disorders. And the definition of arthritis is joint inflammation which refers to a host of rheumatic diseases. People with arthritis are a diverse group, actually, young and old, and from not very much affected to total incapacitation. That would be rheumatoid arthritis. So there are 2 types we're going to talk about here. Osteoarthritis and rheumatoid arthritis. Let's look at osteoarthritis. It's a progressive, irreversible form of arthritis, characterized by degeneration of articular surfaces of the joint. The joints affected are usually the knees, hips and spine. Now hands and feet may be affected also. Rheumatoid arthritis, on the other hand, is a common inflammatory disease that can cause severe damage to many joints, and it involves periods of acute pain during the flare-ups. And the joints most affected are the knees, the fingers and the feet. Fortunately, exercise can have a significant impact on controlling the symptoms of arthritis. The joints most affected would be weight-bearing ones. So I'm going to pause now for just a quick question for you. Name the condition that occurs a hot joint. The answer is arthritis. And the symptoms that are associated with osteo or rheumatoid arthritis are the inflammation of the joints or a hot joint. That's redness around the joint. It's inflamed. Pain, osteo, possibly one joint, rheumatoid, many joints. Decreased range of motion, which would be caused by joint deformity, and muscle weakness due to inactivity. Now, the implications for anyone with arthritis is a significant effect on exercise potential and safety, and it can involve injury to the bone or joint, ligament or muscle, and it can be due to chronic disuse. So they need to work within a pain-free range of movement, avoid locking or intertwining the fingers, In fact, you should avoid locking and entwining the fingers with older people in case they have arthritis or they mightn't look as if they have. Start with a small range of motion in the warm-up to mobilize the joints. And when you're sure that the synovial fluid has started lubricating the joints, progress to larger range of motion. So, a few guidelines. Do longer warm-up to reduce joint stiffness. Include exercise for range of movement, the ROM, and strength. Do mobility and stretching exercises for the fingers and feet. Do gentle, easier movements. Example, chair aerobics or aqua aerobics. Use equipment with caution, of course, wide as opposed to a tight grip. Avoid vigorous exercise that may exaggerate the inflammation of the joint. Avoid exercise where the joint is inflamed, the hot joint, and avoid overstretching. So let's just look at the warm-up. It should be at least 15 to 20 minutes. Fingers, try and mobilize all the finger joints. Playing the piano, but pay particular attention to the thumb joint. Lose the ability to use your thumb joint. Try picking up a needle or putting on your buttons, buttoning up your cardigan. Very difficult. Toes need attention. You could scrunch them up and splay them out as in the fist and fan movement. Now pause again for your task and get the pens and paper ready. I'm going to read this out slowly because this task is, I'd like you to fill in the blanks. Number 1, isotonic exercise for arthritis is where a blank is exercised against a light resistance. And the second question is isometric exercise is where a blank contracts but doesn't move a blank. Now, it's 2 questions, and did you fill out the blanks correctly? So the first blank refers to the joint. So isotonic exercise for arthritis is where a joint is exercised against a light resistance. And the second blank refers to the muscle. Isometric exercise is where a muscle contracts, but it doesn't move a joint. That's the third blank. It refers to a joint. So the guidelines then continued would be to include isotonic resistive exercise. Again, joint is exercised against a light weight or resistance, and isometric exercise may be used where a muscle contracts but does not move the joint, and of course minimize fatigue. Obviously though, if you're using isometric exercise, be very careful to ensure no holding the breath, and fatigue can increase joint pain.